Hi, friends, let us learn about fibroids today. Now, what is this fibroids? We all know that there is some kind of tumor which develops in the uterus, and that is called as fibroids. Now, fibroids are not cancerous. Fibroids are benign tumors inside the uterus. They are well circumscribed and it can be inside the uterine cavity. It can be in the myometrium, that is the muscular layer of the uterus, or subserous, that is on top of the uterus. And there can be broad ligament fibroids, round ligament fibroids, and also wandering fibroids. So, fibroids are different according to the classification and also origin. Now, let us know whether this fibroid is harmful, or if a woman has fibroids, will she be able to conceive, or will she have problems in conception, or does she has to undergo IVF? Well, the facts are that fibroids may not cause infertility, because when a fibroid is there in the uterus, only a fibroid which abuts into the uterine cavity, or if there is a fibroid inside the uterine cavity, that can cause problems. A fibroid which is sitting away from the uterine cavity, a broad ligament fibroid, a subserous fibroid, or a wandering fibroid, will not cause infertility. But if there are fibroids which are coming in the way of conception, they have to be removed. Now, this fibroid, which is sitting inside the uterine cavity, can cause heavy menstrual flow, or it can cause pain to the lady. So, and of course, she can't conceive. So, these fibroids can be removed hysteroscopically or laparoscopically. This is called as minimally invasive surgery. And when there is an option for minimally invasive surgery, the fibroids are tackled better. Now, coming to the fibroids which are there, and then there is pregnancy inside the uterus. Now, fibroids and pregnancy is a big challenge to treat, because there are effects of pregnancy on the fibroid and fibroid effects on pregnancy. Now, the effects of pregnancy on the fibroid is the fibroid can undergo red degeneration, which can cause pain during pregnancy and fever, and patient may need admission but no surgery. It is a conservative management, and patient can be treated conservatively and she will respond. But there are fibroids which come in the way of pregnancy and cause abortions. Such fibroids have to be removed. There are some fibroids which will allow the pregnancy to continue uneventfully, but at the time of delivery, they may come in the way of normal delivery. So, such fibroids have to be tackled at the time of cesarean section, because they will not permit a normal delivery. But there are some fibroids which silently sit on the uterus and which will not affect the pregnancy. And these fibroids can be tackled if a cesarean section is done to a woman apart from some indication, that is, not for fibroids the section is done, but some other indication. That time, at the time of C-section, the fibroids can be removed. So friends, please do not worry about fibroids. If there is fibroid in a woman and it is causing problems, we have to see what kind of problems, whether it is bleeding, pain, or infertility, and each one of this can be tackled. This is because 50% of our women suffer from fibroids, and there can be symptomatic fibroids and asymptomatic fibroids. So let us tackle these fibroids tactfully. Please visit your doctor.